Veridian Microlab welcome you all with new awareness video. This video give you knowledge about World AIDS Day. What is World AIDS Day? World AIDS Day is an annual event held on December 1st. Started in 1988, the purpose of this day is to raise awareness about HIV and AIDS by sharing information concerning prevention, treatment, and control, as well as to honor and mourn the many lives lost to this deadly disease. The focus of this year's 30th annual World AIDS Day is to find a cure. When World AIDS Day began, the disease was considered a death sentence, but recent research into detection and cures has improved life expectancy. Research such as antiretroviral therapies have transformed treatment for HIV. Other novel research studies are investigating diverse strategies from immunotherapy to genetic engineering to vaccine development. What is HIV? HIV, human immunodeficiency virus, is a virus that enters blood. In HIV-positive people, the virus can be found in the blood, sex fluids, such as sperm and vaginal fluids, and breast milk. HIV is too small to see with the eye. What does HIV do? HIV attacks and eventually destroys the body's immune system. The immune system is like your body's army. It normally fights germs, infections, bacteria and viruses that would make you sick. The body cannot defend itself against germs, infections, bacteria and viruses when this army gets weak. What is AIDS? HIV causes AIDS, acquired immunodeficiency syndrome. HIV slowly damages the immune system if it gets into a person's body. This means that the body starts to lose its ability to defend itself against germs, infections and bacteria such as TB. When the immune system is weak, you are susceptible to certain illnesses like pneumonia and TB. This process may take many years to happen. You are then said to have AIDS. A person gets sick when HIV has destroyed most of her immune system. This can take many years to happen. Many people believe that HIV/AIDS is not real. They think that it is a story to scare people to use condoms and stop having sex. However, many people have HIV in their bodies and many have already died of an AIDS-related sickness. What will AIDS do? A person living with AIDS becomes very weak and can get sick from many different germs. These germs can cause problems such as losing weight, bad diarrhea, sores in the mouth, cough, pneumonia, TB, brain and nerve disease, swellings, fevers and sores. These do not get better on their own because of a deficiency in the immune system. Taking medication can help you to become better. How is HIV spread? HIV is spread in the following ways. Sexual intercourse. HIV can be found in the semen and vaginal fluids of a person who is HIV positive. He or she can pass HIV on to another person through unprotected sex, vaginal or oral sex. Pregnancy. HIV may be passed on to a baby from an HIV-positive mother. Not all HIV-positive mothers give birth to babies that are HIV-positive. The risk of passing on HIV to the babies increases if the mother is sick with an AIDS illness or if the mother gets infected with HIV during pregnancy. HIV can be passed to the baby during the pregnancy, at the time of delivery, in breast milk. Many women only find out they have HIV when they fall pregnant. By this time the unborn child is at risk of getting HIV. The chances of HIV passing from mother to child are between 20 and 40% during pregnancy and at the time of delivery. The risk of infection increases if the mother breastfeeds. There are now medicines available to help reduce the spread of HIV to the baby. Blood. HIV can pass from one person to another through his or her blood. Sometimes sick people are given extra blood through a blood transfusion. In South Africa, blood transfusions are safe because blood is tested before it is given to sick people. HIV can be passed on in very small amounts of blood, for example when people share razor blades which are not cleaned properly. HIV can also be passed on by injecting drugs and sharing needles. People most at risk of this happening are injecting drug users, doctors and nurses treating patients with HIV. HIV can also be passed on when handling blood without gloves, for example after an accident, as this blood may contain the HIV germ that could enter through cuts and open wounds. Are there any other ways I can get HIV? HIV is mainly spread through unprotected blood and receiving blood infected with the virus. It can also be spread during pregnancy, birth and breastfeeding. Who can become infected? Some people think that HIV/AIDS is a disease that only affects certain people. HIV/AIDS affects everyone, no matter what age group, race, gender, religion, faith, culture, nationality or sexuality. If you have been exposed to HIV, there is a chance that you have become infected. What are the symptoms of HIV infection? Within a month or two of getting infected with HIV, many people, but not all, can develop flu-like symptoms, swollen glands or a rash. These symptoms usually go away within a couple of weeks, and a person can look and feel well for many years before the symptoms come back. This period when you look and feel well can last 5 to 7 years or longer in adults and 2 to 5 years or longer in children born with HIV. As HIV continues to attack the immune system, the illnesses start to show again. Later signs of AIDS. You can also develop any of the following problems when you get very sick with AIDS: TB, bad cough and fever, pneumonia, pins and needles and pains in the hands and feet, diarrhea that does not stop, weakness and tiredness, tumors on the skin, losing weight, headaches, seizure, blackouts, loss of memory, difficulty in concentrating and difficulty in swallowing. How will I know that I have HIV? You can look and feel healthy for years when you first have HIV in your body. There is only one way to find out whether you are living with HIV, by having an HIV test. Should I have an HIV test? Finding out as early as possible after being infected with HIV is important. This way you can get help and avoid spreading HIV without knowing it. Why must I have an HIV test? Knowing the result can reduce the stress and uncertainty of not knowing. Your doctor or clinic will be able to tell you if worrying signs and symptoms are HIV/AIDS related. There is help available to you if you are HIV positive, one being through Aid for AIDS. You cannot lose your job just because you are HIV positive, there are laws to protect you. You can change your lifestyle to protect sexual partners from future infections, so that you do not infect your sexual partner with the virus without knowing. Decisions about having children or entering into new relationships can be considered. A lot can be done to help you lead a healthy, normal life and slow down the time to developing AIDS if HIV is found early, before getting sick, in your blood. If you are HIV positive and register with Aid for AIDS, approval can be provided for multivitamins and preventative vaccinations to help you remain healthy. How do I have an HIV test? You should go to a clinic if you are thinking about having an HIV test. The health worker should sit down and talk to you about the test. You can decide whether or not to have the test. No one can force you to have an HIV test, it is your choice. If you decide to test, the health worker will take a blood or saliva, spit, sample. This will be checked for HIV antibodies, which are made by the immune system soon after you are infected. Some of the tests will give the results within a few minutes, but other tests need to be sent away to get the results. If your test has been sent away, you will need to visit the health worker about 1 week later to get the result. If antibodies are found, you have a positive test and are infected with HIV. This is why people living with HIV are often called HIV positive. What are my rights? You have to decide whether to go for the test. Nobody, not even a doctor or your employer, has the right to force you to have the test without your permission. The test result is confidential. It is against the law for the health worker to tell someone else the result without your permission. It is important that the health worker explains the meaning of the test to you so you can decide if you want it. Should I have counseling when going for an HIV test? Taking an HIV test is very personal and the test result can be difficult to handle. It is important to get counseling to prepare yourself for the test result. Try local counseling center, or your local AIDS training, information, and counseling center, if you do not know where to find one. What if my HIV test is positive? You are infected with HIV. You can spread it to your sexual partners if you have unsafe sex. You must always use a condom if you have sex. It is important to tell sexual partners that you are HIV positive. Discuss this with a counselor or health worker. You must not donate blood. Pregnant women who are HIV positive may infect their babies. Not all babies will be infected with HIV. HIV can also be passed on during breastfeeding. The test cannot tell when you got the infection or when you will get sick. What if the HIV test is negative? No HIV has been detected in your blood. You may not have HIV if the test is negative. However, it may be necessary to test again. You could be in the window period, which is the time between when you are infected with HIV and the tests used by doctors and clinics become positive. This is usually 2 to 4 weeks. How do HIV is transmitted? Direct contact with infected blood. Sexual contact, oral, anal, or vaginal. Direct contact with semen or vaginal and cervical secretions. HIV-infected mothers to infants during pregnancy, delivery, or breastfeeding. What medicines can I take to prevent illnesses? Medicines can be used to prevent illnesses that you can get when you have HIV. These medicines are known as vaccinations and prophylaxis, prevention. It is important that you see your doctor regularly so illnesses can be found and treated. What about medicines to attack the virus? New medicines can help slow down the disease. These medicines are called antiretrovirals and, if taken correctly, can reduce the amount of HIV in the blood. When several of these drugs are used together, they are more effective and allow the immune system to heal. This means it will take longer for a person with HIV to get AIDS and will help keep them out of hospital. Although there is no cure for HIV, there are medicines available that treat HIV very effectively. There are other illnesses which can also be treated and not cured, like sugar diabetes or high blood pressure. HIV should be seen as another chronic treatable illness. It is not necessary to start taking HIV medicines as soon as you find out that you are HIV positive. A lot of people with HIV remain healthy and well for a long time without treatment. When HIV gets into your body, it attacks your immune system. The immune system will become weaker and eventually won't be able to fight off any other infections. It can take a number of years before the immune system is this weak. CD4 counts and viral loads. Your doctor will measure your CD4 count, the health of your immune system, and viral load, the amount of virus in your blood, to determine the stage of the disease which you are at and to help decide on the best time to start treatment. Once your immune system is weak or if you are having serious symptoms, it is necessary to start taking HIV medicines. Antiretrovirals. The medicines which are used to treat HIV are called antiretrovirals, ART. There are 3 different classes of antiretroviral medicines. Your doctor will usually use 3 medicines from 2 different classes to treat your HIV. The medicines do not get rid of HIV, but they lower the amount of HIV in your blood and the HIV is therefore not able to do as much damage to the immune system. Antiretroviral therapy has the following benefits. The medicines will increase the length of your life. The medicines will improve the quality of your life. The medicines will reduce the chance of you getting nasty infections because your immune system is too weak to fight off the infections. The medicines will boost your CD4 counter and make your immune system stronger. Let us pledge together to stop discrimination faced by HIV/AIDS patients in all forms. Thank you. We'll meet you all in next video. Have a nice day. Stay safe, stay healthy.